And how can we are looking at the nurses' role in trauma care? Nurses' role in trauma care is the prevention in trauma care, pre-hospital, in hospital, trauma emergency care, operative care, trauma IPD care, and post-discharge care and continuum care. The prevention in trauma care, like the transport accident. After we have the program before and after, we have cooperate with the foundation, in each foundation, and to prevent for the trauma care. We have the National Committee for the Road Safety in Thailand also. The prevention in trauma care, we have the program for the child drowning. Because of the child, we in the summer we train for the young children to have to drown and to prevent and collaboration with the other organization. After we teach for the child for preventing. In the pre-hospital, we separate to EMS and referral management. It includes the center command with the phone number 1669. And have the merge. Medical emergency response team and mini-MERS is to help for the like the disaster or in the tsunami in the flood of like and it have the health team to Nepal also. The other role of the nurse at pre-hospital is to teach the first aid and transfer training for first responder in community. In hospital, nurses role from ER to operative care and trauma IPD care. And post-discharge care and continuum care also. The nurse capacity building of the trauma nursing care training center. We also have the trauma nursing courses in Mahidol University, in accident and emergency nursing in Lama Thibadi Hospital, accident and emergency nursing in Bangkok Nursing College. Emergency nursing practitioner in Royal Thai Army Nursing College, and duration like this. We also have the trauma life support program for nurse and medical evaluation from Bhumipol Hospital, 3R post hospital trauma care is the shortcut program. And how we improve the quality system of the trauma center in Thailand, the insurance by Bureau of Epidemiology, Ministry of Public Health, we have the trauma registry and trauma audit. And also Bureau of Nursing, Ministry of Public Health, we develop for the trauma nursing service. Have the nursing service standard for trauma care in 2005 and trauma nursing service guideline 2006. This is the challenge in Thailand, how to drive for the patient safety goal and quality of trauma nursing service. And now we have the role and responsibility. We have the paramedic. Also, is that the new of the paramedic 4-year program. We have the emergency medical technician and the nurse, the ER nurse, and we are trying to setting for the role and responsibility, because now it have some problem of the ER nurse was the responsibility in each team of emergency team. Like, okay, thank you for the attention.
Okay, in the interest of time, we'll just have a few questions. Any questions from the audience?
I had a question for Indonesian presentation. What was mentioned, 5 daily earthquakes. Does that really mean 5 daily earthquakes of Richter scale more than 5?
Indonesia?
Yes, based on the data from the national data, the resource data is yes, like here, like every day, yeah,
every day you experience some tremors.
Yeah, and because we have many islands, yeah, 1,000 islands.
So somewhere or the other,
yes,
you experience tremors.
Many region, but usually in the west region is
more affected. Western region is more affected.
West region of Indonesia is Sumatra and West Java, like that. Yeah, it's the highest incident. Thank you.
Thank you.
So I think the whole geographic zone of Indonesia is mainly situated in the Pacific Ring of Fire. In fact, most of the presentations, they've got experience of earthquakes in the last few years are very unfortunate. There's a lot of learn from such countries actually. And also there are cyclone prone areas as well. So Indonesia of course has a lot of seismic activity. It may not actually result in damage as such as earthquake, but seismic activity is there virtually every day.
For Thailand, this you have this National Institute of Emergency Medicine. Is that right?
Dr. Kanjana?
Thailand.
You mentioned about your experience of
National Institute of Emergency Medicine. So what's the role of this National Institute of Emergency Medicine?
It's the institute of the foundation is the act of the foundation. I think
that
yes, Dr. Silion, she's a committee of the foundation.
The AIIMS, is it now? Yeah. Is a kind of a committee, national committee at the national level, and this committee have to standardize the practice of the nations and try according to the EMS Act that we just developed in 2008, and this is the committee will provide the standard for pre-hospital, in hospital, and try to standardize the personnel, the resources. They have separate funding from the government, so it's kind of looking at the whole community system for emergency medicine.
So this EMS Act is part of Does it come under the AIIMS overall umbrella, this Institute of Emergency Medicine?
EMS Act is the umbrella of all emergency medicine. Yeah.
Okay, we'll get more details when we have bilateral discussion.
Any other questions?
Can I, yeah, please go ahead.
It's the EMS Medical Emergency Board is a national committee, and in the former time, all of the role is for Ministry of Public Health, and we think about that the accidents or the emergency or the evidence is not for only Ministry of Public Health, so we have the National Committee, and after that we collaboration with Ministry of Public Health and Ministry of Education also is so the National Committee, and we think about the situation like this, like the health promotion or like the other that we have to have the National Committee.
Okay, the last presentation will be postponed to after lunch, so we will move on to the next session.
I take that opportunity, Dr. Amit and Dr. Sushma.
Thank you so much, sir. I thank the chairpersons, Dr. Chimeng Craig and Dr. Nitin Agarwal for chairing the session. Before we end this session, I request Professor M.C. Mishra to felicitate our speakers and the chairpersons. Professor Mishra. The first speaker was from Indonesia, the Director of Directorate of Nursing, Dr. Yuti Suharti. Dr. Yuti Suharti, please. Yeah. Then we had, Dr. Yuti Suharti. Yeah. The flag. Your flag. Thank you. Then we have the representative of the High Commission of New Zealand, Jane Conley. Ms. Jane Conley. We have the First Secretary, Embassy of Japan, Mr. Yasuhiro Sensha. Professor Ong Meo Win from Myanmar. And Dr. Kanjana Chanthai from Thailand. Dr. Kanjana Chanthai, okay, right. And our respected chairpersons, Dr. Chui Meng Tek from Singapore. And Professor Nitin Nagarkar, Director, AIIMS Raipur. Thank you, sir. Thank you so much. Without any delay, we'll start the session 2, which is on pertinent issues in the region for road traffic injuries especially. I request the chairpersons, Professor Dr. Raj Kumar. He's an eminent neurosurgeon and an excellent teacher, and right now he is in the formative phase of developing the new All India Institute of Medical Sciences at Rishikesh. Dr. Raj Kumar. Our next chairperson is Dr. Gerard O'Reilly from the Monash University, Australia. He is an emergency physician and international operations manager of Emergency and Trauma Center at the Alfred, Melbourne. He is also senior research fellow, Victorian State Trauma Registry, Monash University, Melbourne. He will be chairing the session.
Once again, this is the special session on pertinent issues in road traffic injuries and trauma care. I think have we introduced the rapporteurs for the session. Also is Dr. Subodh Kumar and Dr. Sanjeev Boy, both from AIIMS, who will be summarising the content of the sessions today. Okay. So I first have the great pleasure in introducing our first speaker of this 1 hour session. We're looking at talks of 20 minutes for 3 speakers. And the first speaker, of course, is Professor MC Misra, and the Director of AIIMS. And Professor Misra will talk to the topic of overview of trauma care systems in India, challenges ahead.
Thank you so much, chairpersons, ladies and gentlemen. I think there is a lot to learn from each other. That's what I have gathered over listening to our speakers in the previous session. Greetings from All India Institute to all of you again. We welcome you all. You must remember and pay tribute to those who succumb to injury. In recent past, we had one of our union ministers, soon after taking oath, he was involved in a road crash in Delhi itself, and one of the very leading artists in Punjab. As we all know, India's landmass is 7th after Australia. We have 29 states, 7 union territories, and there is increased modernization of automobiles and highways, as is happening in every other country. In India is no exception. But India has also the distinction of having multiplicity of road users. And somebody has done a study that 90 types of road users compete for the same road space in India. We also, like Indonesia, we may not be having 5 tremor every day, but 60% of India's landmass comes in the high or medium seismic zones for earthquakes. We have seen some of the worst earthquakes in recent past. Besides that, India also has a distinction of having a huge network of trains. And we have seen some of the worst train disasters in India. As if it was not enough, we have ongoing at-will terrorism and bomb blast. We see in Delhi, we have seen, in Mumbai we have seen, in Coimbatore we have seen, in Bangalore, in Guwahati, you name a city, we have witnessed that. In 2013, June, we saw and experienced the Himalayan tsunami. We don't know how many people were washed away, exact number would never be known. But it was a huge destruction of human and property. Recently, in April end, we saw earthquake in Nepal, which also affected the parts of India, and everybody was witness to what happened. So what we are witnessing today, tremendous human tragedy, loss of limbs, lives, and permanent disabilities. Whether we want it or not, whether we like it or not, it consumes 3% of our GDP, the trauma care alone. And this is at the backdrop and what we get for healthcare in federal budget, less than 2%. So it is out-of-pocket expense. That is what I was trying to make a point, that out-of-pocket expense leads to indebtedness in both urban and rural India for trauma care. If you look at WHO figures, 88% of this burden is now in the developing, or as you call, countries in transition. Developed countries have done well, like we heard from New Zealand, we hear from Australia. They have done extremely well in containing this menace by implementing preventive strategies, enforcing law, enforcing huge fines on drunken driving, and many other preventive aspects. And actually I was glad when we met our Australian counterpart recently in Melbourne that they are working towards zero tolerance for accidents. This is one bizarre incident. It happened in Switzerland that a motorcyclist rams into a car, killing himself and both passenger and driver of the car in which this motorcycle was rammed. If you look at the WHO, the Southeast Asia region and also some of the countries from East Asia bear the brunt of injury, and as you see that 28.7% is the Southeast Asia region. When we look at deaths from trauma, they both exceed put together cancer and heart disease, which is not a surprise. Because trauma is a disease of the young, and years of productive life lost due to injury exceed both put together cancer and heart disease for the same reasons. And if we compare ourselves with traffic fatalities in developed countries, and that is what has been achieved in developed countries, and we need to learn a lot from them. It ranges between 6 to 15 per 100,000, as opposed to India, where we were witnessing what I think some of our friends described, 7 to 8% rise, yearly rise in traffic deaths. But there is a silver lining here. I see that from 2010 onwards, we are seeing a decline. It may not be decline in the actual numbers, but there is a percentile decline in the incremental deaths on roads from 2.2% in 2011, 1.6% in 2012, and actually 2013 we saw a negative, which was a very good thing we noticed, but then it did not sustain. In 2014 again, we see about 3% rise. And if you look at total accidental deaths, comparing from 2002, 2012, 2014, there is 67% rise in total accidental deaths in India, which brings the epidemiology to 30 per 100,000. And I can tell you that none of the cancers in India has that kind of incidence. The breast cancer, which is most common in women in India today, both urban and rural India, the incidence ranges between 14 and 29 per 100,000. 14 in Ahmedabad Cancer Registry and 30 in Delhi Cancer Registry. So you can imagine. Then again in 2013 we saw 27% decline in railroad accidents and deaths. But that was not to be sustained, and what we saw in 2014, almost 100% rise in railroad deaths in railroad accidents. Now when we compare ourselves with the USA, the two large democracies, naturally the population of India is 2.5 times that of US. Total number of vehicles in USA far more than in India. Total number of accidents are also far more in the USA. But when we look at the road fatalities, India is 2.5 times more than US. Our population is also large. But what I am trying to bring to focus here is the probability of my dying in a road crash in India is 1 in 5 as opposed to USA, which is 1 in 69. And that is something to do with the trauma system development, what we are talking about. And if you look at the vehicles involved for this road menace, what we call killer roads, the commercial vehicles constitute largest number. Again, if we look at the urban pattern, then Mumbai tops the list, then Delhi and Chennai and so on. Somebody has very aptly termed injury as a silent genocide, which we refuse to see and accept as a nation. We never talk about dead at workplaces besides road tsunami, and of course the other reasons. WHO projected in 1999 that these were the top 10 diseases responsible for disability adjusted life years lost. Injury is going to move to number 3 position only following ischemic heart disease, cardiovascular diseases, mental health illnesses, which will be responsible for disability adjusted life year lost in 2020. We are already towards the end of 2015. We are not very far from there. So it's a growing realization, I must say, at the government level and also in the nation. There has been realization in Indian context, and that is the reason the injury has been recognized as a major public health problem at the Ministry of Health level. There have been planning of trauma centers along highways, what you heard the health secretary in the morning, upgradation of medical college hospitals, the new institutions which are coming up having a separate setup for trauma care, introduction, implementation of pre-hospital emergency services in at least 18 or 20 states of India through National Health Mission funding. But what is required today is the urgent trained paramedical and medical manpower. And there is a huge gap which exists, what we have and what we need. And that is something we need to think about. So there is a huge challenge for both government and otherwise to plan and build these facilities along the Golden Quadrilateral and to engage trained medical and paramedical manpower to provide 24/7 acute care to the injured persons. Apex Trauma Center with the AIIMS was envisaged long ago, but it came to reality only in